Medical prepping for the problems you'll actually face. Skip the trauma kit for now. You probably won't need it. Stock for diarrhea, colds, boo-boos, and the everyday illnesses that knock people down. Written and read by yours truly, Okie McDokey. Screw-ups and all. A recent agony of bubble guts and trots got me thinking about the real kinds of medical problems I might face in some kind of social collapse or supply chain disruption. Even now, in ordinary times, I get tummy problems 2 or 3 times a year, at least. Nothing dramatic, just enough to knock me off my game for a couple days. You don't eat right. You don't think clearly. You get tired. You start wondering how long you could keep functioning like that if things didn't improve. Which led me to wonder if a lot of prepper medical advice might be a little ass backwards. There's a strong focus on fish antibiotics, trauma kits, and how to handle worst case scenarios, extracting bullets and all that. How often would that kind of thing really come up? During the Civil War, about 2/3 of soldiers didn't die from bullets. They died from disease. A lot of that disease was illnesses that caused diarrhea. In other words, bad water and poor sanitation were deadlier than enemy fire. That's not just a historical curiosity, it points to a pattern. Most of the sicknesses that actually knock people down, and sometimes kill them, aren't dramatic. They're ordinary problems that get out of control. Stomach bugs, respiratory infections, skin issues, small wounds that don't get cleaned properly. Take away clean water, easy access to care, poor nutrition, or just the ability to rest and recover, and those problems can get dangerous. 80-20 rule for medical preparedness. My general approach to prepping is to follow the 80-20 rule. Plan for what's most likely to happen and cause most of the trouble. And when you look at it that way, a pretty consistent pattern emerges. Across a wide range of real-world situations, the same categories keep showing up. 1. Respiratory infections. 2. Diarrheal illness. 3. Skin conditions like rashes, athlete's foot. 4. Minor wounds and injuries like scrapes, cuts, blisters. And 5. Chronic condition flare-ups. That's roughly an order of how often they come up, and it makes intuitive sense. It's what people deal with in everyday life, just with fewer safety nets when something goes wrong. So that's what I'm going to prepare for. The medications and supplies I'm talking about aren't exotic. Most of them are things you probably already have, probably under brand names, or should have under normal circumstances. The difference is being a little more deliberate about it and maybe keeping a bit extra on hand in case resupply gets harder. Never forget those COVID supply chain hiccups. Mind you, none of this works very well if your sanitation falls apart. Clean water, hand washing, and basic food safety do more to prevent these problems than anything in your medicine cabinet. The best medical prep is not getting sick in the first place. Here's what a basic medical stockpile looks like. Mostly stuff you're already familiar with. So here's my basic medical prepping shopping list. For respiratory infections, most respiratory issues are viral or allergic. You're not curing them, you're managing symptoms so you can rest and recover. Here's the list. Acetaminophen, ibuprofen, a thermometer, a cough suppressant like dextromethorphan, an expectorant like guaifenesin, oral antihistamines. You want one non-drowsy option like loratadine. I can't pronounce these things. Loratadine or cetirizine. One sedating option like diphenhydramine. A decongestant like pseudoephedrine or phenylephrine. A saline nasal spray, and some basic masks like a surgical or N95. By the way, all those chemical names, those are just the active ingredients in your Robitussin and your Benadryls and your other standard cough and allergy medicines. Just read the labels and go to the article if you want to see the spellings of the words that I can hardly pronounce. Diarrheal illness. Okay, so this is where things can go sideways fast. The biggest risk is dehydration and electrolyte imbalance. So you want oral rehydration salts, also known as ORS. An example is Pedialyte. Electrolyte drink mixes, example Gatorade. Bismuth subsalicate, an example is Pepto-Bismol. Be warned to avoid that in children or teens with viral illness due to the risk of Ray's syndrome. Loperamide, an example is Imodium. Oral syringes or measuring cups, and some kind of water purification method that could be tablets, a filter, boiling, or bleach. ORS, that is, those oral rehydration salts, are specifically formulated to maximize fluid absorption when your gut isn't working well. Sport strengths help, but they're not the same thing. One important note, though: avoid loperamide if there is a fever or bloody diarrhea, since your body may be trying to clear an infection. Skin conditions. These won't usually kill you, but they can spiral into infections if ignored. So you want some hydrocortisone cream, some antifungal cream like clotrimazole or terbinafine, an oral antihistamine, some calamine lotion, antiseptic solution like iodine or chlorhexidine, and some clean cloths or gauze. If you're not sure what you're dealing with, don't throw everything at it at once, especially steroid creams, which can make some infections worse. Now, minor wounds and injuries. Most serious infections start small, so the key is dealing with them early. So you want some clean water or saline for irrigation, gauze pads, adhesive bandages, medical tape, antiseptic wipes or solution, antibiotic ointment, tweezers, small scissors, wound closure strips like steri strips, moleskin or blister pads, and disposable gloves. Clean it early, keep it clean, and check it regularly. If it's getting more red, swollen, painful, or starts draining, that's a sign things are going the wrong way. Next, chronic condition flare-ups. This is the trickiest category and often the most important. There's no real backup to the normal supply chain for prescription medications, and you can't legally stockpile large amounts in the US. But anything you can do to build a small buffer is a smart move. And I've got a whole article about the situation here with no plan B for prescriptions linked in this article. So what you want to try to have on hand, if you can, your personal prescription medications, a backup supply of your critical meds if you can pull that together, inhalers if applicable, an EpiPen if applicable, glucometer and test strips if you're diabetic, a blood pressure cuff, spare glasses or contact lenses if you wear them, some contact lens solution, and a pill organizer or medication tracker. So here's some other common problems. Urinary tract infections. One thing not on the previous list but worth mentioning is urinary tract infections, especially for women. They're common, painful, and can get worse if ignored. Over-the-counter meds like phenazopyridine, I guess how it's pronounced, which a brand name is Azo, can help with the discomfort, but they don't treat the infection itself. Fluids help, but if it doesn't improve, you're likely going to need antibiotics. In other words, this is one of those edge cases where the limits of home setup show up pretty quickly. Then dental pain. Tooth problems are another common issue that can get bad fast. A small cavity or lost filling can turn into serious pain in a hurry. Clove oil, also known as eugenol, can help numb the area temporarily, but over-the-counter temporary filling material can buy you time. Like UTIs, though, this is one of those problems that often needs real dental care sooner rather than later. Okay, so what about when this isn't enough? So this kind of basic setup handles a lot of everyday problems. I would say most things that you're going to face, but it has real limits. If symptoms are getting worse instead of better, if you can't keep fluids down, if there's high fever, severe pain, confusion, or anything that just feels like it's going sideways fast, you're out of manage it at home territory. At that point, the goal isn't to push through, it's to get real medical help if you can. And if you can't, well, let's talk about what to do about the serious stuff. Now, some of you are probably thinking, what about the serious stuff? Severe infections, trauma, the situations where the stakes are high and the wrong move really matters, and when skilled medical help isn't around. Fair, but that's a different level of prepping, and it starts with training, not gear. You need to be able to recognize what's happening, decide what matters, and use the right tool under pressure. That's not something you can pick up from a list or a stocked cabinet. First aid and CPR courses are a good start, and a bleeding control class is even better. From there, you can go deeper into studying wilderness medicine, EMT training, and so on. There are books that can help too, like Where There Is No Doctor, which focuses less on tools and more on how to think through medical problems when help isn't readily available. Yeah, you'll sometimes hear people talk about stockpiling antibiotics, including veterinary products like, the famous fish amoxicillin. So stocking those things is a workaround. Maybe they're going to work, maybe they're not. Either way, the quality of the antibiotic is not the real issue. The hard part is in getting your hands on pills. It's knowing when they're appropriate, which one to use, and how to dose and and duration it correctly. And that's where laymen who treat themselves go wrong. So that's takes knowledge. Getting some medical training is worth exploring if you want to go further, but most people try to skip straight ahead to the advanced stuff without ever getting good at the basics. And the basics are what you're most likely to need. So my recommendation, start with that basic stockpile. There's nothing wrong with going deeper into medical training. In fact, it's probably one of the most useful things you can do if you're serious about preparing for the worst possible scenarios. But it's not where most people should start, in my humble opinion. Start with what actually happens most of the time. Start with what you can understand, use, and maintain right now. Well, that's where I'm starting. Maybe I'll move on to formal training down the road, but for now, I'm headed to the drugstore to fill out this list. That'll get me 90% of the way there, or better. If you like this, you can tip me on ko-fi.com/okimdoki or follow me on Substack in the socials. Just go to okimdoki.com. Until next time, don't let the bastards wear you down.